How to Become a Doctor in Finland by MEDI Connection, connecting professionals. This information is especially helpful for the international medical graduates residing in non-EU EEA countries who are thinking about coming to work in Finland. So firstly, why should you move to Finland, or should you even consider moving? With its progressive politics, great healthcare system, and overall excellent quality of life, Finland is an appealing destination for doctors looking to work in Northern Europe. Besides, Finland is a great place to work and live. You can earn a good and honest living, and you will also have a peaceful life. Then, when should you move? Currently, there are lots of gaps and unfulfilled jobs. As per Yle News in 2021, they stated Finland's public healthcare sector is missing around 1,000 doctors. The Finnish Medical Association says the answer is not only to train more physicians, but also to make working in the public sector more attractive. The results of an FMA survey polling employers indicate that Finland is lacking some 300 doctors in primary care, as well as 600 specialists. This means an opportunity for international medical graduates to slot into the system. This shows that now is the best time to move. Here are the basic requirements needed to become a doctor in Finland. Verify your certificate. To work as a medical doctor in Finland, you must apply for professional practice rights. Remember this, the first step you should take is to have your education assessed by Valvira. This is the best place to start because of the processing time and possible requests for additional documentation. After you've sent your application, prepare for the UKI test. The second step to take in your career and life as a doctor here in Finland is to pass the UKI test, Finnish language exam. It is the second requirement for doctors who want to work in Finland. Speaking Finnish is essential to a medical career. To learn Finnish, you can choose to study in your home country online by using applications for self-taught courses or immerse yourself in a language course in Finland. In any case, speaking Finnish will be a prerequisite for entering medical school, as well as obtaining your medical license for you to become a doctor in Finland. You need to have a language proficiency at UKI level 4. If you haven't yet reached that level, MEDI Connection provides Medical Finnish courses that are designed to not only teach you the language, but also the necessary vocabulary and everything you need to know for the healthcare sector. We also have written a blog post to help prepare you for the UKI test. The links are in the description below. Take an exam. To be eligible for licensing, you must complete an internship. For the question how and where to find a job training place, we'll be back shortly with detailed information. After completing an internship, you should sit a 3-part licensure examination as mandated by Valvira to ensure that your qualification is equivalent to medical training in Finland. If you have completed these 3 steps, searching for an internship job or amanuensis will be the next step to take. Searching for a job training. Amanuensi is a medical doctor intern training job in Finland. How to search for amanuensis or job training positions. After completing the above 3 steps, you can look for a training job. In this process, international medical graduates are highly recommended to search for a job outside of Helsinki, which is the capital city of Finland. The more you move to other cities, the more likely you get the training job relatively faster. But how do we search for these training jobs? First, if possible, for those who live in Finland, go in person to the health centres and ask for the manager. Introduce yourself and ask for a job. Everyone you meet at the health centre is willing to assist you or show you to the appropriate personnel or manager with whom you can discuss your request. If a person in charge is not around, they will arrange a time so that you can meet and discuss your business with the right person. But you should remember that you are the one who is seeking a job, so it is advised that you go to one health centre as many times as you possibly can. You must put this effort into going in person and searching for the job. Then the second best option is sending an email. Having a template, like a CV, that describes who you are, what kind of education you hold, and other valuable information should be included in this template. With this template, you can send an email to different healthcare centres. Attaching your verified license and the result of the UKI test will increase your chance of getting job training. But how do I find a doctor's email address? It is not always right or straightforward, but in most cases this is the way to do it. In Finland, every city has its website. On the website you will find the social and health section. Under this section you will find the names of doctors. Search for the manager of the healthcare centre or hospital that you wanted to send a job training application. You can send an email using first name dot surname at the city you chose .fi. In this part of the section, we have included tips and recommendations to pass the exam easily. Tip number 1. What does the Finnish medical licensing exam, first clinical exam, format look like? There are 3 separate examinations: a clinical examination, an examination on the Finnish healthcare system, and a practical patient care examination. You must complete the examinations in this order. An international medical doctor who has passed the UKI test and has done a minimum 6-month job training should show language skills when they sit the examination. When the examiner opens up your medical chart and asks you a question from the medical records, the examiner is trying to see if the written information on the text is easy to understand. The examiner is trying to see whether the information you have put on the medical record is understandable. When the examiner opens up your medical chart and asks you a question from the medical records, the examiner is trying to see whether the information you have put on the medical record is understandable. Tip number 2. If writing a medical chart is important, then how to write so the examiners could understand. For example, you could start with a passive form, aloitetaan, in Finnish for saying, let's start. You should not say, I will start. Tip number 3. It is critical to understand Finnish text arrangements, which means the way you arrange your text should be similar to the text arrangement of a Finnish doctor. For example, medical history, what happened to the patient before and what is happening now. Clinical examination, how did you examine the patient and what did you find? Vital signs, blood tests and other investigations. Diagnosis or differential diagnosis. Management and follow-up are the last and most important processes to include on the paper. What do you plan to do now, and what are you going to do in the future? Also, what is your recommendation? Tip number 4. Writing is one of the crucial processes that needs to be practiced often. Tip number 5. The level of medical knowledge required to pass the exam is very reasonable. It is the level of a general medical doctor working at a health centre. No one will ask you specialist level questions. There are no rare syndromes, no rare conditions, no tricks in this exam, so all you need to know is the common conditions and all the fatal and dangerous diseases to treat, avoid or diagnose in this part of the world. For example, more common diseases here in Nordic countries other than warmer countries. In Finland, diabetes and similar diseases would be good to be well informed about. Here are a few additional tips to remember. Whenever you take a case, always rule out the worst case scenario first and then continue with your treatment. Also, remember to explain in detail. Write all possibilities down on the chart. To pass the exam, it is good to learn the past year's questions and answers by heart. That will help you a lot with the language and how to arrange your answers. Also, giving you an idea of what the exam looks like and what the examiners are looking for. For the medical knowledge, you might study from other sources first, but when you are done with those materials, it is advised to learn the Finnish version, like lääkäriksi kirja, to check the same material and understand how it's explained in Finnish, so that you can communicate it effectively to the examiner. Good luck. We will be back with more information for doctors in EU countries in our next video.